Hello doctors, welcome back to Jabstudiesmetfun. I'm Dr. Aishwarya Mokal and this is your part 3 for must-know images of pathology. In this video, we'll be looking at some particular pathologies in different organ systems in our body. The first one is pathology in CNS. The first tumor that we'll be looking at is pilocytic astrocytoma. In pilocytic astrocytoma, there are a particular kind of fibers that are characteristic for it, known as the Rosenthal fibers. You can see these red colored fibers over here, eosinophilic fibers, which are Rosenthal fibers. These are eosinophilic granular bodies. Medulloblastoma. It is a grade 4 WHO tumor with poor prognosis. The most common site is the cerebellum. And the characteristic finding are Homer-Wright rosettes. Very important for the exam. These are the Homer-Wright rosettes. You can see these Homer-Wright rosettes. They look like circular formations which have like a formation of cells which sit in a round around empty space. Meningiomas. Meningiomas, they arise from the arachnoid capsules of the dura mater. And the most important part about it is the Samoma bodies. These are the Samoa bodies which look like an onion peel appearance. So if they ask you about in one-liner as well, Samoa bodies are seen in, or even if they give you the image, you should know that it's a meningioma. Next one is schwannoma, peripheral nerve sheath tumor, and it is also known as acoustic neuroma. The most important thing about it is it has verrucae bodies, which is an acellular mass. So antennae A and antennae B are two kind of phases that you can see a schwannoma in. You can look at it that antennae A is very much more pigmented than antennae B. So why is that? It's because antennae A is hypercellular as antennae B is hypocellular. Pathology in respiratory system. The first one we will look at is ARDS. In ARDS, what happens is there is a hyalinization of alveolar walls. That is, the hyaline deposits in alveolar walls will cause it to become stiff. So there is a stiff lung. In the next few images, we'll look at some of the pathology seen in asthma. The first one is Crayola bodies. Crayola bodies is the sloughed out respiratory epithelial cells. When the patient is coughing too much, it will cause the respiratory epithelial cells to be sledged out. These are the Crayola bodies. Kirschmann spirals. In Kirschmann spirals, the mucus will get impacted into the different respiratory tracts. So it is a mucin impacted plug. You can see that it takes the shape of the tract that it is impacted in. Hence Kirschmann spirals. Charcot-Leyden crystals. Charcot-Leyden crystals are sort of crystals with in the sputum which are eosinophilic. You can see that they are like spindle-shaped crystals in the sputum. Next one is bronchiectasis. In bronchiectasis, you can see there are cavitary lesions. These are cavitary lesions. It is a permanent destruction and dilatation of large airways. So the large airways will around the large airways, you can see that there are cavity formations. That is bronchiectasis. Anthracosis. Anthracosis is the deposition of coal inside the lungs. It is also called as coal workers disease, and the lesions inside the lung will be a coal macule in which you have a coal and macrophage. So this black color stippling in the lung with the history of the patient's occupation being a coal miner worker, it points to the diagnosis of anthracosis. Asbestosis. Asbestosis has asbestos bodies or ferruginous bodies. These are rod-like bodies with beaded appearance, and it is seen in plumbing industry workers. Squamous cell carcinoma. How to identify squamous cell carcinoma is by keratin pearls. They will tell you that it is a pathological slide of a lung, and you can see this sort of eosinophilic body, which is basically accumulation of keratin which is the characteristic of squamous cell carcinoma. Small cell carcinoma. In small cell carcinoma, there is a characteristic appearance of salt and pepper chromatin, in which you can see small tumor cells, which looks like it is which looks like there is sort of someone has sprinkled some salt and pepper, as you do on a dish, inside the chromatin of the small tumor cells. It shows azoparty effect. The different kinds of pathologies in heart. The first one we see is ash of bodies, seen in rheumatic carditis. It is the most common feature of rheumatic carditis. It is made of macrophages, lymphocytes, fibrinoid necrosis, and Anitzkov cells. So you can see these ash of bodies are pinpointed over here. These are basically an accumulation of all of the macrophages, lymphocytes that rush to the site of the infection. Anitzkov cells are cells with caterpillar-like chromatin. You can see in this image particularly, the chromatin will clump together in a formation that looks like a caterpillar, seen in rheumatic carditis. In myxoma, you can see that there are stellate cells. It is composed of myxomatous tissue in the heart. This is a myxoma. Spider cell. Spider cell is the one which has a chromatin which goes out in like a spider web fashion, and it is seen in rhabdomyoma. Pathology in vascular system. So what can we see in the different arteries and veins of the body? The first one is hyaline arteriosclerosis. It is seen in the patients of diabetes mellitus and hypertension. In arteriosclerosis is mostly common in comorbid disorders. It is the deposition of hyaline cartilage in arterial walls. So you can see that there is a hyalinization of the arterial wall. Hyperplastic arteriosclerosis. It is arterial smooth muscle proliferation. You can see that the thickness of the smooth muscle that is present in the arteries originally, it is a very thin layer. It is a very thin functional layer, but in malignant hypertension, what happens is the smooth muscle will proliferate due to hypertrophy. Monckeberg medial sclerosis. It involves tunica media. And it is seen in aging patients where there is a dystrophic calcification. You can see in the image, there is a dark color calcification seen in the arteries, and which looks like it looks like something like a foreign body, but what it is, it's deposition of calcium in it. Giant cell arteritis, also known as temporal arteritis. The temporal artery is involved. Giant cell in granuloma is seen, and there is a rupture of the internal elastic lamina. You can see that there is also over here, I'm not sure if it's that clear or not, but the internal elastic lamina is pretty much continuous over here, but over here it is ruptured. So that is the characteristic feature of giant cell arteritis. Churg-Strauss syndrome. Churg-Strauss syndrome, also known as allergic granulomatosis with angiitis. It has an eosinophilic infiltration in the arteries, and granulomas can be seen. So there will be eosinophilia and there will be formation of granulomas. Polyarteritis nodosa. It is a medium-sized vasculitis. It mostly involves the kidneys, and most common cause of death is renal failure. There will be a segmental transformer involvement. So you can see that there is a fibrinoid necrosis. If there is a fibrinoid necrosis in medium-sized vasculitis, it is polyarteritis nodosa. Cavernous hemangioma. It is mostly seen in adults. It is seen in skin, liver, spleen, and CNS, and it has a bad prognosis. Capillary hemangioma. Capillary hemangioma is a benign condition. It is commonly seen in children, and it regresses on its own. You can see in this child, you can see that the capillaries have formed a hemangioma on his eyelid, and it will most likely regress on its own. It just occurs on its own and it just goes away on its own. Next one is Kaposi sarcoma. Kaposi sarcoma has elongated spindle-like cells. There are proliferating blood vessels. It is caused by what virus? HHV8 or KSV virus. That is a Kaposi sarcoma virus. Most common vascular tumor associated with AIDS. Very important point for the exam. You can see that the cells over here are spindle shaped. They are like the spindle shaped cells, and they are causing this spindle shaped lesions over here also. So that's it for today. Thank you so much. Please follow us. Please join our Telegram group.